Welcome back to CI Living, where I'm on location in Paris at Paris Community Hospital, and joining me now is Dr. John Rowe, who is an orthopedics and sports medicine doctor here. Thanks so much for hanging out with us this afternoon, Dr. Rowe.
Well, thanks for coming and visiting.
Well, yeah, so you've been practicing for over 20 years, but Central Illinois really isn't your home. Tell us a little bit about what brought you to Paris.
Well, I grew up in Southern California and trained in orthopedics up at the Mayo Clinic and went back to Southern California and practiced in San Diego for about 20 years. But I saw it get so congested and so expensive that it was time for a change. And it didn't matter really where I went. I was looking for an opportunity where there was a need. And I had enjoyed the Midwest because the values are a little different here than they are in Southern California. So I was in Gibson City for 3 years, and then I'm starting on my third year here at Paris Community Hospital.
So what is it exactly that you do here at Paris Community Hospital?
I am an orthopedic surgeon, which means that I see problems that relate to bones, joints, muscles and tendons, people that get injured with a slip and fall, people who overexert themselves athletically. So pretty much any of the body aches and pains outside of stomach aches and headaches and things like that.
Although I'm sure you'd have some advice on that too.
Well, I have opinions about a lot of things. But
Right. Well, we got to meet with some of your patients that you've performed surgeries on, and they really could not say enough good things about you and just raved about you. So what would people experience when they come to you maybe for a visit? What would that be like?
Well, I like people to feel comfortable, and I don't like them to feel rushed because I don't like to feel rushed. So I introduce myself as Dr. Rowe or Chip, as an orthopedic surgeon, and spend a few minutes to find out what they do for a living, what they like to do for recreation, because that's important in creating a treatment plan for them. Because someone who works in a factory as opposed to someone who's a high school athlete, they have different levels of expectations about what they want to be able to get back to. So before I even ask them really what brought them to see me, I want to get a little sense of who they are as a person and what their expectations are. And then we talk about the nature of their problem, the typical things, where, why, how, and then I examine them. And one of the things I think I do that is becoming a little bit forgotten in medical practice, I will actually sit down with them and explain to them in terms that they can understand what their x-rays show, what I think on their physical exam, and what I think is going on. And we'll actually talk to them about, the various options and get them involved in taking some responsibility for the decision-making process.
Yeah, now, when I've told people that I was coming to Paris to do this interview with you, they didn't even know Paris had a hospital. So what makes Paris Community Hospital different than maybe other facilities?
Well, it falls in a rural community, which puts it in a little bit different classification of hospitals. There's a whole network in Illinois of what are called critical access hospitals. They have a goal of providing for the immediate needs of the community, and they have an opportunity to really secure their future by providing the highest level of care to common problems. I mean, if you have, a very rare tumor, this isn't the place to come. But for, appendicitis, gallbladder disease,
knee replacement,
arthritis
hip
of
replacement,
the hips and knees and that sort of thing, we have the opportunity and the facilities to be able to provide the necessary care for those. We do have a little niche, which is one of the reasons I like the critical access hospital, is that after I perform surgery on somebody, I don't feel rushed to have to get them out of the hospital to a nursing home, that sort of thing. We actually have the opportunity to keep patients an additional 21 days if necessary in what's called the skilled bed program, which is really nice for patients who have prejudiced about nursing homes, which I probably share, and don't want to go to a nursing home. So the comfort of being able to stay here until they go home is really an attractive feature.
Yeah, well, it's definitely been great getting to know a little bit more about you. And if you need to know anything else about Paris Community Hospital, it's all part of our IllinoisHomepage.net's Premium Health Connection, and you can get connected at CILiving.tv.